Welcome to today's edition of Mental Health Matters. Today we're going to be talking about the benefits of volunteering. I have a guest on the show that's going to talk about 5 different programs that you will have the opportunity to volunteer in if you're interested. Stay tuned. Sandra, thank you so much for being a guest on our show today. I always start off with thanking the guests because I know a lot of the guests that come on the show, they're very busy and they have a busy schedule, and I'm sure you do.
Thank you.
So let's start off with you just kind of telling me a little bit about yourself, and we can kind of go from there.
Okay. I'm Sandra Mattingly. I am originally from Kentucky.
Nice.
I worked with the senior corps programs in Kentucky.
Oh, nice.
And I moved out here about 5.5 years ago, and I was fortunate enough to get the same job again.
Oh, nice.
So I already knew the programs, knew what I was doing, and landed in that position, and it's been a great fit so far.
Nice. So back in Kentucky, it was was it like a branch program, or was it a program that you guys did similar services, so to speak?
Actually, it was a part of the Corporation for National Community Service, just as the programs that I work with out here.
Nice.
So we had the same 3 programs: foster grandparent, RSVP, which is the retired and senior volunteer program,
nice,
and the senior companion programs. There I worked solely with RSVP. Okay. I did help out with foster grandparent and RSVP there. Foster grandparent and senior companion there.
Okay.
But here I work with all 3 programs.
Okay, nice. So what particular agency do you work for that these particular programs is under?
I work for Sacramento County in Senior Volunteer Services.
Okay.
And they are our local sponsor. However, all of the programs across the country are federally sponsored through the Corporation for National Community Service.
Okay. So these particular programs, they're spread out throughout the, not just the state of California, but other states like Kentucky and other, okay.
All across the country, and also in Puerto Rico.
Oh, nice.
I know they're at all 50 states, and I know they're in Puerto Rico, and I'm not really sure about other territories, but yes.
Oh, nice, nice. So let's dive into it. So what kind of led you to these particular programs? Because I know I've seen you out in the community, and we've kind of sat in the same circle, so to speak, at network events and stuff like that. And I've heard you kind of present on some of these programs, and I know you're very passionate about the work that you do. So that's one reason I want to have you on the show. So what kind of led you in this particular direction?
Well, when I was 9, my grandmother was in RSVP because the programs were designed back in the 1960s. They were funded in 1973 as a part of the Domestic Volunteer Service Act.
Nice.
And I'm not going to say how old I am, but let's just say that when I was 9, my grandmother was in RSVP. So I have known about RSVP for a very long time.
Nice.
I also come from stock that believed in volunteering.
Yes.
My grandmother had always volunteered. My parents volunteered in various capacities. And as a teen, I started volunteering at the Humane Society, mainly because I wanted to play with puppies.
Nice.
But when you play with puppies, there are a lot of things that go along with that, cleaning up after them, doing the adoptions and things like that. So I got started volunteering as a teen. Nice. And have just stayed with it all the way through. When I moved to Sacramento, I came to the Sacramento Food Bank and Family Services, started as a volunteer there.
Nice.
And started looking for a job and found the application online to apply for a volunteer coordinator position, having no idea that it was one of the jobs for the Corporation for National Community Service.
Nice.
And whenever I got a letter a couple of months later saying that I was eligible to interview, just couldn't believe it.
Nice. People, people that I'm sure people that know that you are very, very passionate about what you do.
Absolutely.
I mean, I know the first time that I saw you present, I think we were at a meeting. I think it was the Asian Pacific Center, somewhere around there, and one of those type of meetings. I'm not sure if I'm pronouncing the agency name correct, but you presented, you gave a lot of goodies away, and I was like, okay, she's passionate about what she do.
Absolutely.
And then we was at another network meeting, and you kind of talked about the programs and stuff. I'm like, okay, I got to get on the show. We got to explore these programs. But I want to also find out, in your opinion, what do you think the benefits are to volunteering? Because some people have different reasons as to why they volunteer.
They do.
And I want to hear your reason.
Well, obviously my passion, I hope, shows to everyone.
Yeah.
Because it is important to me. And one of the reasons I'm so passionate about this age group working, because 3 of our programs are age 55 and over.
Yeah.
And a lot of times folks have already retired or thinking about retiring. And I saw it with my own father.
Yeah.
You don't need to retire and go home and sit down.
Exactly.
Because you're not growing, you're not living, you're just pretty much waiting to die.
Yeah.
And there are many health benefits to volunteering.
Yeah.
Volunteers, statistically, and there are scientific studies to document this. I'm not making this up.
Yeah.
This is something that you can back up from scientific study. When you volunteer, your social circle broadens, you're less isolated, you're less depressed, therefore you take less medication.
Yes.
So your blood pressure's lower, you have more friends, you're a happier person. So if you can find a great volunteer gig like RSVP, foster grandparent, or senior companion, and get out and get involved in the community, you're going to live longer and you're going to live happier.
Yeah, I definitely agree 100% with you. It was a lady from my church, and it's interesting because I just found this out maybe about a couple of years ago, and I had been knowing them for a while. She told me that her and her husband are well off financially, so to speak. He's no longer here. But she said one of the things that they did was they made sure that they got their children involved in volunteering at a real young age, because they did not want them to feel as if they were privileged.
Absolutely.
Because they had things and was able to afford things that other people could not have. So they took them out to feed the homeless, soup kitchens, and just whatever it is they were able to do, they were able to get them involved. And because of that, they have a passion for people.
Absolutely.
Giving back to the community and things like that. We also know that volunteer improves your mental health as well, because it gives you a sense of pride as you give back to the community. You learn job skills.
Yes.
With giving back, and like you said, if you're of a little older in age, then it will kind of improve your social skills. You won't be isolated. You won't just be, at home and stuff.
Right.
And so I think that is that's good, so to speak. So
I have a great story.
I want to hear it.
About volunteering.
I want to hear it.
So at my office in Kentucky, I was sitting at my desk, and you know how you feel someone looking at you.
Yeah.
And I looked up, and there was a tall, thin, elderly gentleman. He was obviously affluent himself.
Yeah.
And he was standing in my doorway, and he was quite weepy. And I looked up and acknowledged him, and he said, "Are you Sandra Mattingly?" I said, "Yes, I am."
Yeah.
And he said, "I was told to come up and talk to you." And I said, "Okay." And he said, "My doctor and my family say that I have to volunteer." And I was, okay, well, what would you like to do? And he said, I would like to help people manage their portfolios. Well, we're a federal program. We can't get involved in other people's money.
Yeah.
But what a nice thing for him to offer to do. So
Yeah.
I deduced that he was most likely a numbers guy. He had retired as the head of our local electric company.
Wow.
Had an engineering degree. Obviously was very affluent from where he lived and the way he was dressed and stuff. But anyway, I encouraged him to become a part of the VITA program, which is Volunteers and Tax Assistance.
Nice.
It was where I was currently volunteering, and I knew that it was a great thing, and it did feed your soul.
Yes,
you know,
absolutely.
you're helping, you know, people that have very low incomes to get back the most money that they can, and that
Yes.
really matters because you know, we all want to live as good as we can on what we have.
Yeah.
So I invited him to go with me to the informational kickoff luncheon. We went. He became a greeter screener because at this time this fellow was well into his 80s and had been retired for many years, and most likely didn't have any computer skills. I didn't ask him.
Yeah.
He could make the decision on which stack of materials to pick up,
Yeah.
whether he was going to be a preparer, which is what I had been doing, or a greeter screener, which required less skill, but you interacted more with the folks, the families, and made sure they had all of their documents in order.
Yeah.
So he opted for the greeter screener line, which was a big relief to me because I wasn't sure how he was going to handle the other situation. And he did start. I placed him at the site where I did taxes, but on a different day.
Yeah.
And I would stop by and do site visits with that fellow, and he was always happy and smiling. And and for the 4 years that I was still in that position before I moved out here, he was there smiling every tax season and rubbing elbows with those that I'm certain had much less than he, and was a very happy man. And I'm certain that it saved him from what I had in my very uneducated opinion, seasonal affective disorder. I feel like he always had SAD every year, and what a brilliant man and supportive family he had, and a brilliant physician and supportive family to tell him, not Dad, you should volunteer, but he was told you have to volunteer.
That's awesome.
And he did.
That's awesome.
Yes.
That's all. And it's good that his circle of support was able to recognize that and able to encourage him to do so, because they knew that this was going to be something that was going to improve his quality of life, so to speak.
Right.
That's awesome.
Yes.
That's awesome. So let's dive into about the programs.
Okay.
Because I know you work with some really good programs.
I do.
So you could just start off just kind of talking about RSVP and, you know.
We do have 3 senior volunteer programs under the Corporation for National Community Service.
Okay.
All 3 of those do require that you be age 55 or over.
Okay.
2 of those have folks in them that are low income.
Okay.
And I'll talk about those in a second, but right now let's talk about RSVP,
Okay.
Retired and Senior Volunteer Program. And with RSVP, you do have to be 55 or over. We do not have any income restriction or minimum or maximum amounts of time that you serve.
Okay.
Basically, we will just find you something that you want to do, whether you want to be challenged, whether you want to have fun, maybe you just want to do something mundane to take up your time. We currently have about 35 different agencies that we partner with in around 130 different locations.
Okay.
Mostly in Sacramento County, but some in Placer, some in Yolo, and a few in Sutter. And in that program, we currently have about 350 people enrolled that are volunteering on a regular basis.
Nice. Mm-hmm. So what are the qualifications, other qualifications besides the age, that people can actually get into that program to volunteer?
No other qualifications, just 55 or over.
Nice.
Mm-hmm.
Nice.
And we do provide them with a little bit of insurance while they're volunteering, also a death benefit while they're volunteering. And if they volunteer in some of our focus areas, helping veterans, feeding others, helping children read, working with seniors, we can even reimburse their gas mileage if they're volunteering in one of our focus areas. Now, all of our 35 community partners are not in our focus area.
Okay.
But we do have tons of fun things you can do.
Okay. So what do the volunteer actually do?
Oh, we have folks that deliver for Meals on Wheels.
Oh, okay.
We have folks that do the food banks,
Okay.
giving away the food. We do have folks that are teaching children to read. We partner with Reading Partners. I'll give a little plug to them.
Nice.
They usually help me whenever I find a person. They usually help get them all set up,
Okay.
get them started at the school, that needs them the most, or at the school nearest their home that is a reading partner site. We have other folks that just go into schools near their home and read.
Yeah, wow.
We have folks that go out and they're through the long-term care ombudsman program, and they check on the quality of care of those in the long-term care facilities, which is a pretty weighty volunteer assignment, but it's so important.
Yeah.
We've got people in those facilities that have no one that ever checks on them.
Yeah. Oh, yeah. I can believe that.
Right. So RSVP is doing great things all
Yeah.
over the country, but we're doing great things here in Sacramento.
Nice.
Very
nice.
proud of that program.
Nice.
Yes.
So what about the foster grandparent program?
Okay. Well, foster grandparent and senior companion, they're pretty similar in some ways.
Okay.
In that both of those programs, the volunteer has to be 55 or over, and they have to meet an income guideline.
Okay.
For a family of one, it's 200% of poverty. It's about $2,010 a month.
Okay.
The income guideline does go up if there are more people in the home.
Okay.
So you can make a little more if you have a family of 2, 3, 4, 7, whatever. And those folks are obligated to serve a minimum of 15 hours a week.
Okay.
And they get a stipend of $2.65 an hour for volunteering.
Nice.
So
That's very good.
it's great, and
Yeah.
it is a stipend. These
Yeah.
folks are a volunteer, not an employee.
Right.
And it's a stipend. It's not taxable income, so they don't report it on their taxes. It's a federal program. We're doing everything as the legislation dictates.
Yeah.
And these folks get around $300 or more a month for that $2.65 an hour, and it's not affecting any benefit.
Nice.
So if they live in HUD housing, if they're getting food stamps, if they're drawing disability, anything like that, it's not affecting any of their benefits.
That's awesome. That's awesome.
And they are also provided with a little bit of insurance while they volunteer. So even if their glasses were to get broken, their false teeth were to get broken, if a foster grandparent was to be going into a school to volunteer,
Yeah.
and maybe the sidewalk had become uneven and they tripped over it and
Yeah.
fractured their wrist or something, we're going to help them with their doctor bills. We have a little bit of insurance.
Wow.
And again, we have that little death benefit if anything should happen while they were volunteering.
So the qualification for these programs, just the age 55 years old and older?
And to be low
And
income,
Wow.
which
wow.
is 200% of poverty, so it's still fairly generous.
Yeah, that's
Yes.
really good. Like, because, a lot of volunteer programs, because of the funding, does not offer those benefits.
Right, right.
So,
We also reimburse all travel. So if they are, let's just say a foster grandparent,
Yeah.
they can walk to school if it's close enough, if they choose to, but they can drive and we will pay their mileage. They can take paratransit or they can take public transportation and we will pay for their bus pass for the month.
oh, wow.
So they can get back and forth to volunteer.
Wow.
And foster grandparents, they are helping children with their skills.
Okay.
So they're most likely placed at a facility near their home, and the majority of the time it's at a school.
Okay.
We do have some in hospital assisting children that are, with very, very, very sick, or babies that are born drug addicted, things like that. We do have some folks doing things like that.
Yeah.
We also have a couple of volunteers at juvenile hall. And that's a pretty weighty volunteer assignment, but the two we've got there, they have a heart for it and they are just changing lives.
Wow.
So those foster grandparents I have another story about
I
a
wanna
volunteer
hear.
at juvenile hall. So one of them is a male and one of them is a female, and our male volunteer's name's Jeff. And Jeff, I was down there doing a site visit one day, and there was a young man. He was sitting at the table with us and we were talking, and he was reading a great big book. It's called Monster. It's a great big book. College level reading. I read the book because one of my children had to read it in a college class, and they said, "Mom, you would love this book," and I did.
Yeah.
And this young man was reading Monster, and he was sitting there with Jeff while I was doing my site visit. And the young man said he loved the book and he was looking forward to reading the sequel and all that. So I talked to Jeff a few weeks later at a meeting, and I said, "How's your young fellow doing?" And he said, "Oh, he had invited me to meet him at his hearing because he had a court hearing." And Jeff said, "Oh, I'm excited. Will I meet your parents and your grandparents and everything?" And the young man said yes. And Jeff showed up, and he was the only adult there to support that young man.
Wow.
And this is a young man that is, I'm guessing 14, 15 years old, reading on a college level,
Yeah.
who is probably going to take the rap for an older gang member for a murder charge.
Yeah.
And Jeff was the only person, only adult to show up there to support that child.
Yeah. You know, first of all, that is a phenomenal story that Jeff was there to support him. Unfortunately, a lot of that goes on. I can attest to that because the environment I grew up in, how I grew up, a lot of times you don't have the support of loved ones, and you have very intelligent kids out here, super intelligent, but they just don't have that support to push them. And sometimes they find themselves getting in trouble, getting involved with the wrong people, and because that's all they know. These are the ones that's showing them the love.
That's right. It's their family.
Exactly. That's exactly right. And so it's unfortunate, but I'm glad that Jeff is doing the work that he's doing to touch people's lives like that.
He is.
Yeah, it's sad.
Our other foster grandparents, most of them are placed in schools, and the majority of them are placed in elementary situations because you may not be aware, but there is a statement that floats around out there. It's not 100% true, but there is some truth to it, and that is that they base the number of prison cells on the number of children who don't read on grade level at the end of 3rd grade.
Wow.
I was told that, and it broke my heart, so I did research it, and it's not 100% true, but it's still an impactful statement, and there is some truth to it.
Oh yeah, I believe that. I
Right.
definitely believe that. Because people that fall in a category tend to go another route in life, so to speak. They don't
Yes.
have the confidence. They don't, and they don't have people pushing them. I know I have a family member who has a learning disability, and she struggled, through her years of being a youth. And at the age of 11 years old, she kind of got out there in the street. She's run away from home, and she kind of made a career out of crime, so to speak. And now she's a little bit older, and she realized the mistakes that she made. And I remember talking to her maybe about 2 years ago, and I was actually on my way to the movies, and she called and she was like, see, like, you can get up in your car, you can go this place, you can fill out an application, you can do this. And she was saying, I can't do that, and she started crying, and she started saying how she always wants to be a nurse. I never knew that. This is a family member. And she was saying how she always wanted to be a nurse, but her learning disability kind of forbid her to go that route, so to speak. She was always ashamed of asking for help.
Absolutely.
It's tough for people like that,
And our schools aren't equipped with enough help to help children. They're not.
Yeah.
And our program is offering free help.
Wow.
We've got volunteers that are there minimum 15 hours a week, and they're assisting these children with their skills, meaning anything from academics to even redirecting bad behaviors. We don't provide any sort of discipline, but redirecting bad behaviors, even eating lunch to model good nutrition.
Nice.
And it's free help for the schools.
Yeah.
And it also feeds our volunteers. It keeps them getting up and going out, and it enriches their lives.
Yeah.
And it's a ripple effect, because these volunteers, sometimes years later, they may not recognize the child,
right,
but the child recognizes them, whether it's at McDonald's or the grocery store or someplace else. Positive role models have a huge impact on children in their futures, and that's what we're providing free of charge for these volunteers that are getting this stipend, and it's helping them to maybe not have to choose between food and medicine, or car repairs and a haircut, or things like that. So it's making their lives better too, but the impact that they're having on our communities is immeasurable.
Yes. So how do the schools, how do you guys connect with the schools? Do you reach out to them, or do they reach out to you guys? How does that work?
A little bit of both, but mostly we reach out to them, and we when we train these folks, everyone goes through live scan fingerprinting,
Okay.
sex offender registry. They have a physical, they have a TB test.
Nice.
And they're properly vetted, and they go through our training program. And then a lot of times we just place them in a school near their home.
Nice.
We can't break the bank on mileage,
Of course,
paying
yeah.
them to drive all the way across Sacramento County or something like that. But basically, we just try to place them in a facility near their home.
Yeah. Yeah.
And a lot of times we place them where we already have volunteers at that site, so that they have the support of other seasoned volunteers.
Exactly. Exactly. What type of training do you guys kind of put them through? So
We
to speak?
usually spend about a week or so with them, and
nice.
we have a thick handbook
Yeah.
that we go through, and then we have a lot of videos that they have to watch on different things,
Yeah.
like suspecting abuse, different ways that children learn.
Yes. Yeah.
Just things that they should report, things they should be aware of.
Yeah.
And then, like I said, we do try to place them where another volunteer is if we can.
Yeah.
Because that gives them another listening ear.
Exactly. Yeah, shadowing is very needed for me at least.
Yes.
When getting trained, because
Yes.
you get, for me, it gives me a different perspective to see how people do things. Mine might be a little bit different, but at least I can see how this person do things, and
Yes.
that's
Very important.
Yeah, it is important. So let's talk a little bit about the history of these programs, if we not already talked about, because I know we've been doing a lot of talking. So give me a little bit of history. I know you talked about how some of the programs, one program your grandmother was in and so forth. What about the history of some more programs?
Well, with Foster Grandparent, Senior Companion, and RSVP, the framework was laid out by Sergeant Shriver. He was a fellow from California during the Kennedy administration back in the 60s. And then we were totally funded in 1973. And basically, they were designed to help keep people engaged in the community, to keep them actively engaged, keep them happy and healthy in their own homes.
Yeah.
So that's why they were designed. And then the stipend was put in place to allow these folks, the ones that are in the foster grandparent and senior companion programs, to allow these folks to have a little bit of extra disposable income.
Yeah.
We always try to impress upon them, don't go buy a car based on getting this, or
Right.
don't count on this to pay your bills.
Right, exactly.
But we know that it does happen, because there are people who live on very little in our community.
Yeah.
And this is helping them have a better life.
Yeah.
So the programs were really just designed to enrich people's lives and keep them engaged in the community. A lot of the nonprofit agencies, particularly that RSVP serves with, they couldn't make it without our volunteers, or they would be operating with a skeleton crew.
Oh, I believe that.
Right.
I used to run a program that, we had volunteers. Pretty much they was like the rock, the root of our, program.
Absolutely.
Because without them, wasn't nothing moving.
Right. Exactly. Right.
So, yeah. Interesting.
Right.
So you talked about two more volunteer programs besides the one.
Can I tell you about Senior Companions first?
Okay, yeah, let's talk about that.
Okay.
Let's talk
So
about that.
Senior Companion, it's another one of our senior core programs.
Okay.
It's another one that utilizes the low-income volunteers.
Okay.
And they serve other seniors. So right now, our federal grant does require that Senior Companion program use drivers. So to be a part of Senior Companions, not only do you have to be 55 or over and meet that income guideline, but you also need to have dependable transportation.
Okay.
The goal of Senior Companions right now is to reduce isolation and allow other seniors to remain happy and healthy in their own homes.
Yeah.
So, our volunteers, again, they're vetted through the same processes, the live scans, the TB tests, the background checks, the sex offender registries. They are put through our training program. Actually, I was in a Senior Companion training today, and we'll be continuing that training again tomorrow. And then those folks will be assigned one of our Senior Companions that have been with our program for a while,
Okay.
and they will be doing some shadowing. At least 20 to 30 hours of shadowing before they get assigned to an agency. And then we have 7 or 8 partnering agencies. We will assign those volunteers to the agencies that have clients in the areas where the volunteers live. So if you live in South Sac, you're going to be assigned an agency that has clients in South Sac. And then we try to form, it's a companion friendship type situation where, let's just say that you were needing a senior companion and you were allergic to cigarette smoke and cats.
Yeah.
Well, we would try to assign you a volunteer who did not smoke and did not have cats.
Exactly.
And maybe you needed someone on Wednesday mornings, and this volunteer had available on Wednesday mornings. There would be an introduction, and the two of you would have to agree that it seems to be a mutually beneficial relationship for the both of you.
Right.
You like each other, seem like you may have things to talk about, and stuff like that. So you have to live in the same area. The schedule has to match up. The likes and dislikes mostly match, and you just had to feel like you had a good vibe or a good juju. You know what I mean? Yeah. So then you would be assigned that senior companion, and they could come by every Wednesday morning.
Yeah.
And you would have a list of things to do, whether you needed to pick up your dry cleaning,
nice.
Go to the doctor, go to the dentist, go to the library. Maybe you wanted to go to the congregate meal site at one of the senior centers and have that congregate lunch.
Yeah.
Because they serve a balanced lunch there. So the senior companion's role is to allow you to accomplish the things you need to do outside of the home to allow you to remain happy and healthy in your own home.
Nice.
There is one other little part of that we don't do a lot of, but we do, and that's provide respite.
Okay.
So if you had a caregiver that was taking care of you, let's just, for the sake of an example, let's say that you had dementia and maybe you tended to wander. So maybe your caregiver needed to get out on Wednesday mornings to get the groceries, or maybe your caregiver was exhausted and wanted to take a nap and a bubble bath. So our senior companion could come in and spend that time with you and provide your caregiver with the opportunity to do the things they needed to do to allow them to continue to care for you while you age in place, happy and healthy in your own home.
Good service.
Right.
Great service.
Again, free for the client, and our senior companions are making the $2.65 an hour, so they're having that little bit of extra income.
Yeah.
And we're paying their transportation cost to go back and forth and to do all the things that need to be done.
And so with this particular program, the insurance is offered as well?
Yes. It's free. It's provided free. All the programs across the country provide those little bit of insurance.
Yeah.
We always have people fill out their enrollment forms, and we always have to tell them on the beneficiary, don't put yourself. You're not going to take it with you.
Oh, that's for sure.
But if something happens, if something happens, we do want your family to be able to collect that little bit of insurance.
Yes, absolutely.
So it's rare, but it does happen.
Yeah.
So it's there and available, provided free. Just one of the other added benefits of being one of our volunteers. Yeah.
Well, I'm telling you now, this is definitely, all three programs is great because, as I stated earlier, I don't know any other volunteer programs that offer, the benefits that's been offered through these particular programs.
Yes. We're a well-kept secret, and we don't want to be.
Yeah.
I'm out talking all over the community. You've seen me at several events. I'm out talking all over our area, trying to get people, to raise awareness of our programs and what we're doing and our need for volunteers, because the impact that we're having on our community is huge.
Oh, yeah.
Huge.
Oh, yeah. So the agencies, you talked about the partner agencies. Let's talk a little bit about that. I don't know if you can expose who they are, but like how's that connection made? Like, so are the agencies that have seniors that need you guys assistance?
Yes.
Okay.
Yes, there are. And I can't probably quote every one of those off the top of my head, but we definitely partner with Adult Protective Services and Home Support Services. Okay. And actually that coordinator is right in our office. She's my counterpart, Roseanne. Okay. And then we partner with Eschaton, Sac Chinese Community Center, La Familia, Stanford Settlement, Sutter Care Pace.
Okay.
And the others I'm not,
That's a lot, though.
I did pretty good.
Yeah.
Right.
That's a lot.
Yes.
Wow.
So,
Okay.
And do you have time for me to tell you a story about senior companion?
I love hearing stories, so have at it.
Okay, well, this one's a little different in that my son, he's a finance major.
Okay.
And so the world for him is not the warm fuzzy stuff so much as it is the logic and how the bottom line, the numbers. Okay, so one day he said, Mom, you're always telling people that your programs are saving millions of dollars in tax dollars. And I said, yes, we are. And he said, okay, well, I want you to explain that to me now. I've been doing this for 13 years. So I have seen the impact that we've made on the communities, and I know all the great things that the programs are doing all across the country. But for me, my best work is balancing my checkbook, and it rarely happens, okay? So I had to try to think like my son thinks. And I said, the best way that I can try to relate this to you is if you had 2 senior companions and they were volunteering their minimum, and sometimes more, 15 hours a week, and they're getting $300 a month in their stipend check. So if we've got those 2 volunteering and they're each getting $300, that's $600 a month. And if they're volunteering for a full year, that's $7,200, because $600 a month times 12 months is $7,200. Okay, that's already taxed my brain. But let's keep that thought in mind, $7,200. And we've got 2 senior companions that are low income. So if they were to be at home and depressed and unhealthy and on medication and end up in a long-term care facility, they're low income, they're going to be in a Medicaid bed.
Absolutely.
In that Medicaid bed is going to cost minimum $7,000 a month.
Wow. Yeah.
We're paying $7,200 a year to keep these 2 folks active and healthy, engaged in the community, and happy in their own home. And keeping them out of a Medicaid bed. So we've got $7,200 outlay for these 2 folks. And we're saving ourselves $7,000 a month. So basically, we've just got 11 months of we've just avoided 11 months of Medicaid bed coverage charges. Wow. Okay, so then we've got those 2. And let's just say that they're serving 5 clients each. So those 5 clients, not always, but a lot of times those clients are low income as well. Well, they're keeping those clients happy and healthy in their own home and out of a Medicaid bed, which we know costs $7,000 a month. So 7 times 12, I don't know what that is. I think it's $8,400. So we're talking $84,000 a year. And let's just say all 10 of those were low income. And they were going to be in a Medicaid bed if they weren't being served by our senior companions. Now we're talking $840,000 a year.
Wow.
For those 10 clients to remain happy and healthy in their own home. And my son bought that. He was like, that makes sense. And I said, absolutely. And we're only talking about 2 volunteers here.
Wow.
And we're inching near 40 volunteers in that program.
Wow.
So we're having a huge impact on the community. We're also having a huge impact on the tax dollar. Because we're saving so many tax dollars all across the country.
Oh yeah, absolutely.
Yes.
Absolutely.
Yeah.
Absolutely. And this is why programs like this need to be funded.
They
and
do.
Need continual funding.
Yes, they do.
Because of the impact that it is making on a community.
Right.
When I get 55, I can see myself, being involved with something like this for real.
Right. Absolutely.
Because I do believe in volunteering. I do believe in helping people.
Right.
In various capacities. So.
Right. I'm very proud. I'm very proud to be associated with these programs and the work that we're doing and our volunteers and the impact they're making on our communities. Because they're not only impacting themselves, but the impact is rippling all throughout our communities. You think about if your client maybe relies on their daughter to take them to the grocery store or to take them to the doctor. Now the daughter doesn't have to miss work for the doctor's appointment because we've got the senior companion that can take them to the doctor's appointment. So it's increasing productivity at work. They don't have to worry about their mother. They're more focused. So many good things are happening as a result of our programs.
I'm glad you brought it up. I like that comment too, because I go visit a lady in Napa, haven't been in a while, but, and so I wanted her to connect me with another older lady down here in Citrus Heights. And this lady has a daughter and in-laws, and they live, I think, live in Rockland or somewhere. But her daughter only comes down once a week. But the other 6 days of the week, the mother is lonely. She's kind of isolated, and she needs that companionship.
Right.
So I offered to volunteer my time, to just kind of go over there and check on her and see her and just maybe do groceries runs and things like that. And so that's needed. That's needed. And also with these programs too, they need people who can understand their needs.
Absolutely.
Because a lot of times the family members like, well, Mom, you need to do some walking, or you need to get out there and do this and that. And the parent tried to explain to them, at least in this lady's situation, no, I can't walk or whatever. And so the daughter thought that she was just being lazy. Well, she took her to the doctor, and the doctor said, no, your mom should not be walking because of her condition.
Oh, okay.
So it's good to have people in place who can relate and understand the need of the client that's being served, is what I'm trying to say.
Right.
So,
I totally agree with you. A lot of folks I hear say, well, I just ask my mom, to please get up and get dressed every day, and maybe she can run the vacuum cleaner. And that is a little bit of exercise, and it does, get them out of the bed and get them dressed and ready for the day. But a lot of times, it's not safe for them to go out walking.
Exactly.
They can't, they shouldn't be outside the home. Either, right now, certainly because of the air quality, but maybe the neighborhoods they live in, or the risk of falls, or there are a lot of reasons why many of our senior companion clients should not be outside their home without someone taking care of, someone with them.
Oh yeah, absolutely, absolutely.
Right. So can I tell you a senior companion story that's not related to money?
Okay, I want to hear, because most of the time on my shows, I'm very transparent, and I'm always going into these stories. So I'm glad that you're telling a story.
I like to tell stories because I think it makes our programs relatable to to people that maybe can't envision how we operate and what we do and stuff. So we had a volunteer who was assigned a lady. And I believe the lady was 93. I'm not sure, but I believe she was 93. And she kept going to this lady's house, and the lady wouldn't answer the door. And she kept being encouraged to continue to go. So finally, eventually, the lady would open the door, but she wouldn't allow her in. The relationship progressed to where the lady would come outside and be hiding behind the bush when our senior companion would show up. It was probably, I don't know what the time frame was, but it was a period of time before the volunteer was able to make a connection with this lady and get her to where she would allow her to come into her home and the two of them have conversations and things like that. And she discovered that at the age of 93, her client had never had Baskin-Robbins ice cream.
Wow.
So she ended up taking her to Baskin-Robbins, and that's what they would do every week. And at some point in the not too distant future, she determined that there were people that were taking this lady's money. And she had to contact the appropriate authorities, and they ended up, I think it was a conservatorship. I don't really know the legal mumbo jumbo, but they ended up, taking control of the situation and getting the lady, I guess the oversight that she needed and stuff like that. But it was our volunteers' persistence that changed this lady's life, because she was losing all of her money. And then not only that, she got to have Baskin-Robbins ice cream.
Exactly.
Right.
That's another key component or important part about volunteering, especially with these particular clients, because sometimes you do have people that's involved that is taking advantage.
Absolutely.
And that's where the APS training comes in place, when they can identify and know how to report and, get other people involved. I actually experienced a similar situation with one of the programs volunteer program that I was running. Unfortunately, the lady's son was taking advantage of her to the point where this lady was having suicidal ideation. And had that volunteer not got involved, this lady probably would have committed suicide, all because her son was taking advantage of her financially.
Right. It does happen. Yeah, it's a sad situation, but it does happen, and we do train our volunteers to be aware and how to handle those situations and to whom to report.
Yeah.
And our senior companions are mandated reporters.
Yes.
So they do. Now, we do tell them you can report anonymously, but you are a mandated reporter,
Yeah.
as they should be.
Yeah, absolutely. Absolutely.
So it's just a safety net to
Yeah.
have a senior companion in the home. It's another set of eyes and ears. And it's a beneficial service that we provide free.
Yes.
It's a free service.
Yes.
So
Yes. So what about the other 2 programs?
this is for you, Jesse.
Okay, this is for me.
These are for you. So you don't have to be 55.
Okay.
And you just have to be age 21 or over.
Okay.
And these are called the Telephone Reassurance Home Visitor Programs.
Okay.
And with Telephone Reassurance, basically, you're vetted, you go through a training and all that, and then you would be assigned folks 55 or over to reach out to on a regular basis through a telephone call.
Oh, nice.
So you can call, you can call from our office, or you can call from your home after you're trained.
Nice.
And you don't have to be 55. The clients are 55.
Right.
We started out with, these are sponsored by Sacramento County. They're not a part of the Corporation for National Community Service. They're ours.
Yeah.
And they were just recently resurrected because we had these in place before budget cuts years ago, and they
Yeah.
just got newly resurrected. Basically, you're assigned specific clients to call on a regular basis. So maybe you make a phone call every Tuesday at 1
Oh, nice.
to Sandra. Maybe
Yeah.
Sandra needs a call every Tuesday at 1.
Yeah.
So you would call me every Tuesday at 1. You would know me. You would learn me. You
Yeah.
would recognize if my speech were slurred.
Uh-huh.
I might divulge something kind of scary to you. Maybe someone was, trying to open my window, stuff like that. So you would learn this person, and you would just basically have conversation on a regularly occurring basis.
Yeah.
And that's what telephone reassurance is. And then friendly visiting, or home visitor, which sounds like what you're doing, you would visit that person at the same time on a regular
Yeah.
basis.
Yeah.
And you may even take them out for, kind of like a senior companion
Coffee,
does. Coffee or groceries or
yeah, doctor's
the
appointment.
doctor, anything like that.
Yeah.
And then we do have one other little part of that, and that is if the person, the best example I can use is a colonoscopy.
Okay.
Because when a person has a colonoscopy, they give them some kind of crazy anesthetic.
Yeah.
And people do really nutty stuff. They've committed crimes and do a lot of things they don't remember.
Yeah.
Excuse me, I heard of someone that bought a bunch of clothes and didn't remember buying all these clothes, wondered how these clothes got here. But when a person goes in for a routine colonoscopy, they have to have an assistant there with him.
Yeah.
With them. They are not allowed to take a cab home or paratransit
Yeah.
without someone riding along.
Yeah.
So actually our home visitors, if they're given enough time, which is at least 2 weeks,
Okay.
they can actually even assist someone that is not a regular client, but someone who needs to go have a medical procedure or something like that done,
Oh.
but they don't have, anyone to assist them. So we do have volunteers that will step up and do that as well.
Okay. Nice.
They're screened, they're trained, everything. So there should be no reservation about this person helping.
Okay. And so you guys, they go through training, and they know that they are also mandated reporters and
Yes.
things. Okay, that's good.
Yes.
That's
yes.
really good.
Absolutely.
Yeah.
Yes.
So how could a person get involved if they want to volunteer with either one of these programs?
They are welcome to call our office. They can look us up. I gave away my brochure that had my contact information on it, but they can call me at 916-875-3592.
Okay.
They could call the RSVP main line at 916-875-3616. Someone will try to call them back as quickly as possible. I don't mean within a few minutes, though. I mean within 2 or 3 days. Give us 2 or 3 days, because we have a pretty big volume of calls coming in.
Yeah.
They could leave a message on either of those lines if they would like. If they want to research the Senior Corps programs, they could go to cns.gov.
Yeah.
That is the federal website for the national programs, and they can get on there and look.
Okay.
And it can direct them to us, or I believe that Max or someone was going to put contact information there off of our brochure.
Yeah. Yeah.
There are websites for all 3 programs listed on there, and the phone numbers listed on there as well.
Yeah.
So, and then if they want to get in touch with the other two programs, the ones for the folks that aren't age 55 but serve age 55, they are welcome to call me and I will direct them to Roseanne. And again, my number is 916-875-3592.
Okay, so those programs is funded through Sacramento County?
Yes, sir, they are.
Okay.
Yes.
Okay.
They just need to be patient because I am the coordinator of all three programs, and then Roseanne has a lot on her plate as well, but if they'll leave a message, they can call us and we will do our best to get someone situated in whatever situation they want to be in, whether it's something fun or just something mundane to take up their time, or something challenging, learn something new.
Yeah.
We'll find them something fun to do.
Yeah, nice.
Yes.
Do you guys ever have like a waiting list for volunteers or clients or both?
Well, we usually have folks that are waiting to become foster grandparents and senior companions.
Wow.
Because we don't do the trainings. We wait until we have a few, and then we do the training because it's the wisest use of our resources. We do have to be good stewards of our federal money.
Yes.
And then as far as clients, it would depend on the agency that they are involved with, because to get a senior companion, you have to be a client of one of our partnering agencies.
Okay.
And then they would assign the senior companion to you.
Okay.
And then foster grandparents, we do have, I just got an email this morning from a teacher that was interested in trying to get a foster grandparent for her classroom. School's starting back up.
Nice.
So the word does get out, thankfully.
Yeah.
And they learn about our foster grandparents and want to have the free help in their room.
Yeah.
And if it works out where we have a volunteer that lives in that area, a newly trained volunteer, or a volunteer that has moved, or one that wants to change sites or whatever, a lot of times we can go ahead and meet that need.
Yeah.
We try really hard to meet those needs.
Yeah. How often do you guys have your training for the senior program and the Go Grandparent program?
Oh, usually 2 or 3 times a year.
Okay.
Right.
And the reason why I ask is because I know when I was overseeing a couple of programs that we had volunteers to kind of go in and provide service to the seniors and stuff. So at first I had it set up where when they applied, then I was trying to get wait like 3 months to get enough people to get this training started. But the barriers that I was running into, they started losing interest.
Right. They found other things to do.
Right. And so I'm like, oh my God. And so what I did was I started doing like a mini training.
Okay.
I did enough to get them started, and then I did kind of like the big training every quarter.
Oh, okay.
But that kind of kept the volunteers' interest and stuff, because
Right.
it was hard.
Right.
And I couldn't figure out, like, why are these people not interested no more?
Right.
Like, don't they understand I got to get enough people to get everybody started?
Right.
But they're like, no, I don't want to volunteer no more. You had my interest right then, and you should have took,
Well, with
So-
RSVP, we do an orientation every
good.
month.
Okay,
we do
that's good.
every month with RSVP. With foster grandparent and senior companion, we usually will go ahead and get them started on their paperwork.
Okay.
Because they do have to get their background check. They do have to get their physical and their TB test and get their TB test read. So, and then we also have annual forms that they have to fill out, which states their income, their
Okay.
emergency contacts, their beneficiaries, those types of things, so that we have that in place when they start.
Yeah.
So we can already start them on their paperwork.
Okay, that's good. That's
Yes.
good. So all 5 programs, people in the community is interested, they contact you and you can kind of assist them
Yes.
on getting started.
Right. I'll pass them along
Okay.
to whomever they need to be passed along to. The senior core programs, I will be their contact person. And the telephone reassurance and the home visitor programs, that's Rosanna Raza. And she sits right beside me.
Okay.
So there's just a wall between us. We talk over it all the time.
Okay.
So I will pass their information on to Roseanne.
So a quick question, do you know how many clients that is in those particular programs that she run?
I don't know how many clients she is serving right now. I believe, because this is so new, I believe she is up to 6 volunteers there so far.
Okay.
And no,
Okay.
I have no idea how many clients she's
Okay.
currently serving.
And I only ask that so when people watch this program, you know, I mean, obviously it's a need for all the programs
Right.
per se,
Right.
but, you know, kind of get an idea where if people want to say, oh, I want to volunteer, where it's mostly needed, so to speak.
Right.
So.
Right. You know, one thing that we do is we concentrate a lot on the part of town.
Okay.
Because we're paying mileage, and you know we can't break the bank
Yeah.
on our mileage.
Okay.
So we usually concentrate on specific areas of town, and even when we're out recruiting, we try to recruit in the areas where we know we have the biggest needs.
Yeah. Okay.
So and we some of our sites only serve certain areas, like Stanford Settlement. You know, they only serve like I'm thinking like 6 or so zip codes there in North Sacramento.
Okay.
Over to Natomas and Rio Linda in that area.
Okay. Okay.
So,
Well, we've run out of time, and I want to thank you for being a guest on the show.
Thank you.
And that's it for today's edition of Mental Health Matters. If you enjoyed this particular topic, or if you would like to be a guest on our show, or if you would like a DVD copy of this particular show, please dial 916-366-4600. Thank you.